Good evening. It's Dr. John Bennett broadcasting from Miami in the Rheumatology channel with the Rheumatology studio with Farhan Tahir, a board certified rheumatologist from Philadelphia. He's going to continue on his weekly series of rheumatology programs. And this week, Farhan's going to talk about a few articles in the literature. And okay, greetings, Farhan, and welcome.
Yeah, hi, John. How are you? Good to meet you again. I'm excited to be back again on your forum, and we are going to be talking about something interesting today. It is, where does rheumatoid arthritis start? So, all these articles are going to talk about how rheumatoid arthritis get inside our bodies. It's really interesting. And first article that I'm going to be talking about is the what is the connection of smoking with rheumatoid arthritis. So the first article title is "Smoking Boosts Genetic uh, Risk and Increasing Joint Erosion." So this, we know that smoking is an environmental risk factor for many diseases, including cancers, and now we know autoimmune diseases are also linked to smoking. In rheumatoid arthritis, smoking has been the strongest environmental exposure that is linked to development of rheumatoid arthritis. It is believed that smoking triggers citrullination of the proteins in the lungs. Now, what is this process? It's a mouthful. Citrullination is when amino acids like arginine get catalyzed to convert into a protein called citrulline, which is then is a foreign protein uh, in our lungs and gets attacked by immune system, and that is what leads to development of our immune system going to cause more and more antibodies against this citrulline protein. And many rheumatoid arthritis patients are currently diagnosed by development of these antibodies called anti-citrullinated protein antibodies, or CCP antibodies. In early stage rheumatoid arthritis patients who might be smokers, it is believed that actually it may accelerate joint damage, which is interesting. So now we are talking about not only development of rheumatoid arthritis, but we are taking it to the next level. We are saying that rheumatoid arthritis is actually accelerated or gets worse when you smoke. When you're an active smoker and you have rheumatoid arthritis, it's really not a good combination, unfortunately. And a study out of, I believe this study was done it was presented in American College of Rheumatology, and they found out that patients who had smoking or non-smoker new onset rheumatoid arthritis patients within 10 months of diagnosis were followed for about 2 years. They had regular x-rays done in rheumatology evaluations, and they found out that those patients had more erosions. So erosions are these irregularities in the joint lining that create deformities. They can become bigger. They're almost like as you would see as cracks in the joint lining that would cause this deformities that are consistent with rheumatoid arthritis. Hands turn into right side or left side, and that what happens much more in patients with smokers. One good thing that I saw out of this study was that they said there was no difference in past smokers and non-smokers. So if we can convince, even with this idea that okay, patients who are smokers, if they quit smoking and their rheumatoid arthritis, with time they would be just like non-smokers when it comes to their joint progression in rheumatoid arthritis. So I think it's really important for us to go back to the basics of smoking cessation, because it is um, it is something that we should be talking about. Uh, so I just want to another thing which actually is very similar to what we just talked about. The next article that I have is about work exposure. So the work exposures are linked with rheumatoid arthritis, and it is primarily seen in males. So this is our second article that we're going to look at it. And This article was looking at uh, are there any occupations that rheumatoid arthritis patients may be more predisposed to and may develop rheumatoid arthritis? Because a lot of times, as you know, um, John, patients say, "Well, is there anything I'm doing that might be causing me to have rheumatoid arthritis?" Well, there's a study that found out that work exposure is linked. So in Sweden, 3,500 cases were identified, and they had about 5,500 control patients. They found out that especially in men, occupations with exposure to noxious airborne agents were actually at a risk, were causing a risk for development of rheumatoid arthritis. I think it's really interesting because now we are talking about not only smoking, but other things that people may be inhaling that can trigger rheumatoid arthritis development. They identified that patients who had bricklayers related job or concrete workers, men who dealt with material handling operators, electrical workers, their odds were almost tripled for development of an aggressive form of rheumatoid arthritis, which is also known as CCP rheumatoid arthritis. Now, many listeners would remember we just talked about the anti-CCP antibody relationship in smoking. Now we are talking about the same antibody that is an aggressive form of rheumatoid arthritis in people who actually have jobs that expose them to some airborne chemicals that can lead to development of rheumatoid arthritis. And it's interesting because the reality is that it might be the same process that the smoking triggers the citrullination in rheumatoid arthritis. The same problem might be going on in patients um, with our sudden environmental exposures. Interesting enough, they also found out that for women, the occupation at risk was assistant nurses and attendants. And it is very ironic. I'm really not sure what is going on there because it is surprising to me that women who are working in healthcare industry as assistant nurses and attendants, why are they getting it? But when the researchers digged into this, they found out that maybe physical workload may be an associated risk. It's hard to explain and justify, so I'm just going to take it with a grain of salt, but that is also part of the study that we looked at it. So, overall, the bigger picture now that we understand is rheumatoid arthritis has some complex connection between immunity, our genetics, and our environment. So, many toxins that are linked to development of rheumatoid arthritis, they include silica, mineral oil, asbestosis, pesticides, textile dusts. They all are thought to trigger citrullination process. These some other toxins, including organic solvents, metal fragments, and motor exhaust, can also do the same thing in our immune system. These toxins, the chemicals trigger immunity, and our cells actually become citrulinated, the proteins in it, and then our immune system is now making our own body tissues target. So what happened is our innate immunity, which primarily is our cells that fight any invading organism in our body and then create antibodies, they get activated through some receptor cells that actually are present in lungs, and then they would develop this inflammation. They also activate certain type of cells called antigen presenting cells. So a lot of immunity is actually starting to develop now. So the triggering of pro-inflammatory cytokines such as tumor necrosis factor is linked to this development of autoimmunity. So this was in the discussion part of our second article. Now I see you have the third article up, and I'm gonna start that. Where does rheumatoid arthritis start? So that is another important topic that we are now discovering. That okay, we talked today about smoking. Smoking is in inhaled in the lungs. Then we talked about work exposure and chemicals and toxins and silica and other things that can cause rheumatoid arthritis development through citrullination of the proteins. Now, the next topic here is, what about our mucosal membranes? And mouth is, of course, is the first entry point into our body. And where is there something going on there that might be linked to rheumatoid arthritis? Some studies back in 1900s showed that oral sepsis was an hypothesis led to actually therapeutic removal of all the teeth of patients with rheumatoid arthritis, because at that time scientists and physicians believed that teeth infection was causing people to develop rheumatoid arthritis. So this was interesting because now back in 1900s, when people were talking about oral mucosal cells and infections and development of rheumatoid arthritis, now we in 21st century are back to talking about microbiome, and what lives in our gut can be linked to development of diseases, and what lives in our mouth can cause diseases. As you know, infections such as streptococcal infection can cause rheumatic fever. Similarly, there are some oral pathogens that have been found to cause periodontal disease, and they've been linked with rheumatoid arthritis. So there is an organism called P. gingivalis, which has been found in rheumatoid arthritis, maybe as a cause for this disease. So this organism carries an enzyme called PAD enzyme, and it citrulinates the proteins which trigger autoimmunity. Again, we're talking about the same process, and we're talking about now an organism that lives in our in our mouth and gingival tissue that could be causing rheumatoid arthritis by having this enzyme in it that would denature or cause citrullination of our proteins. So now we have antibodies again for the same thing, the CCP antibodies that predate development of rheumatoid arthritis. So antibodies to this organism P. gingivalis have been found in rheumatoid arthritis, and that is something that we have now maybe a responsible factor for development of this disease. Um, I remember that we had patients who had rheumatic fever in my medical school and were told to be very vigilant in cleaning their teeth because poor dental hygiene can cause rheumatic fever, which is also like an autoimmune arthritis or reactive type arthritis disease. So I believe that this science is really true because people who have gingival diseases or periodontal diseases do have higher incidence of um, autoimmunity. Now, there's also some concept that, okay, could it be working the opposite way, like the dysregulated immune cells causes more poor hygiene or poor immunity of the mouth and people develop diseases. But I think hygiene is more related to causing disease than the other way around. So, and the other article that I brought that also connects with the same concept of what we are talking about today, and I'm going to look back and pull that up. It's called Gut Bacteria,
Okay, I
and
got it up.
you got it. Okay, and a
Yeah.
potential game changer for rheumatoid arthritis. So, this this is an interesting topic. I think it's books are being written on this topic right now. It's like an amazing amount of microbiome information is coming, and what we are seeing is that we need to we need to understand how these trillion of microbiome are living in our gut and maybe causing relationship or development of diseases. Um, and NYU researchers studies found a connection between intestinal bugs and development of rheumatoid arthritis. They found out that an organism called Provitella, which is found in our gut, is actually abundant in patients with untreated rheumatoid arthritis. And there's been studies that looked at treatment of rheumatoid arthritis with antibiotics like doxycycline and sulfasalazine that controls inflammation in the gut, because it is believed that the inflammation by either the imbalance of microbiome or what people eat or anti-inflammatory medicines trigger inflammation, or and the ecosystem of our microbiome is changed, and the genetic material that is carried by so many trillions of microbiome changes our cells and our proteins, and then eventually lead to development of inflammation and arthritis. So it is believed that this Provotella, which is abundant in rheumatoid arthritis patients, may trigger an inflammatory response that targets the joints. So this is now the new frontier of medicine: how to modify the microbiome, how to make it the healthiest to avoid diseases. So we are looking at interventions which are targeting the microbiome, which may become eventually therapeutically viable for some type of inflammatory or rheumatoid type arthritis. We know that many times we have used or told patients to use probiotics like lactobacillus and acidophilus and KCI, and they help reduce inflammation. And some studies have found that they are maybe more effective than even anti-inflammatory medicines such as indomethacin in treating arthritis symptoms. So if we can bring back the balance of the microbiome, it would be helpful. So RA treatments may benefit from adopting Mediterranean diet, which is high in fish and olive oil and vegetables, because the plant fiber carries probiotics that trigger development of, prebiotics that trigger the development of probiotics and then can help further with the disease. So, this is a quick summary of those articles that I chose today for our discussion. And going back to the same, that there is some link between our environment and our genes that actually triggers our immunity. And it is believed that a large amount of immune cells live in our gut and our lungs. And I think that might be the areas where we can pinpoint that in certain susceptible patients, the immune cells in the lungs are responsible for causing inflammation, where there might be a process going on where our proteins are being citrulinated and our immune cells cause antibody there, versus sometimes it is coming through our gut through a similar process or a slight variation, but the end results is inflammation, development of antibodies, and joint pain. Eventually, that could lead to deformities and significant other problems.
Very
So,
good. Very good. Thank you, Farhan. You said some interesting stuff. I just have a couple of questions and comments.
okay,
One
sure.
one was about the dentulation, that patients actually had their teeth yanked if to prevent the progression of rheumatoid arthritis. During your career, did you see that, or was that before your time?
It's long before our career. I mean, it was in 1900s. We're
Oh,
talking
okay.
about like early 1900th century, where this was the concept that they were doing it. I'm sure now no, even if we were to tell patients, they're not gonna be very happy with us, or they would
No.
say, okay, we've.
Yeah.
But I. Still, it's funny that environment does play a role, and I know that not too long ago rheumatologists used to tell patients with rheumatoid arthritis to go down and live in southern states where the weather is not really cold, because they would have less pain. But eventually it was found out that it was not related to how the temperature is outside. It's actually the environmental triggers that might be responsible for causing this, including smoking and other things. So
Mhm. And another interesting point you raised, of course, which we could devote a whole show to, is the microbiome. And I think we may have mentioned that a week or two ago, how it's
yeah,
classified as an organ now. And students
exactly.
are
And
actually they're studying it a lot more than you and I did in school.
I know. I believe now that the most medical schools are gonna be talking about microbiome in their clinical courses, because it's huge information coming around and how that could be modified to change the course of disease.
Hmm.
Many books are out there. I just recently, a couple of months ago, read a book called Super Genes, which talked about the role of our microbiome changing our genes. So we can not change certain genes, but there's debate that the theory was what your genes are, that's what it is. It can be changed, and it's really intriguing now that is there.
So wow, so think the disease concept of rheumatoid disease is changing.
It's changing, and it was thought that we would not be. Uh, it was believed that rheumatoid arthritis is something, it's like a ghost came in somebody's body and destroying the joints, and now we are saying, well, it's something we could modify. I think that's really exciting
Hmm.
that we could modify it, and by simple things that could be a game changer. And if and I think many disease incidents could be decreased if we were to tell people that your microbiome, I'm sorry, is going the wrong way. We need to do something, and this and this diet changes, and this is this what you should do, lifestyle changes wise to make it healthier. And then we could have these markers of microbiome health, and maybe stool test or something. I mean,
Hmm.
it sounds a little gross, but I mean, really, the matter of fact is, if we can prevent diseases by checking people stool samples and say, well, this is the disease that you could avoid, these many diseases you could avoid. I don't have any problem checking that. If somebody could tell me that, okay, uh, for compared this year to last year's stool samples, you are actually becoming chances of development of disease is this. You should revert back to a different lifestyle and diet. I would change it because I, if I have a warning that I could change a disease, I could avoid my chances of development of rheumatoid arthritis or dementia or even other autoimmune diseases and cancer. Yes, I would like to do it. I think that's it's coming. I mean, there are already studies. There are companies who are actually linking the microbiome and genetic profiles. It's just not mainstream yet, but I've come across. Couple of companies who have started looking into it. I've not used it, so I'm not endorsing or mentioning names, but it's on my radar. I'm actually going to start looking into it pretty soon and starting to do a little bit of a cohort study, a prospective study on those patients, and see if we could make sense out of this, because I'm really excited about lifestyle changes making a difference in prevention of diseases that are so expensive. I mean, most rheumatoid arthritis patients cost about 50, treatments can end up between like their blood tests and their medications about 60,000 to 70,000 dollars a year treatment. I mean, that's huge cost to our healthcare system.
And another topic is the cavalier prescribing of antibiotics, since it does affect the microbiome, because the microbiome is our bacteria, and it makes you kind of wonder, because you know that as physicians, a lot of times we give out antibiotics pretty freely,
Oh
and
yeah,
and what
sometimes.
kind of effect does it have to the with the microbiome?
Yeah, it's yeah, sometimes we're just afraid to say the truth. Be honest with you, we just don't want to we don't want to say it to the patient, because we don't want to be sound like, okay, you don't know what you're talking about, this is not an infection that you need an antibiotic. We just
Right.
don't want to make leave an unpleasant experience. But I think the reality is that we as physicians should also assume role of educators,
Hmm.
because patients are not to be blamed here. If I am going to a mechanic, I should be listening to him. If he says I don't need to change something, I should not be insisting on changing it,
Right.
especially when an insurance company is going to be paying for it. It doesn't happen anywhere else other than health system, which I'm not sure why. But I think the reality of fact is that sometimes as doctors, we should take role up as leaders in health education and public education, and educate patients that their particular fear is not founded in reality, and we have science to back it up that it would cause them more long-term damage, increase cost of not only healthcare cost but also diseases that would be difficult to treat. and will create bigger problems for us down the line. So it's a matter of that we should be thinking carefully about these things. So I'm glad you brought it up. It's really good points you're bringing it up. Yeah.
Well, I think once the microbiome was studied more, and if they can get studies that show there's a deleterious effect on the patient if they're just given antibiotics for a viral infection, if they really have proof of causing damage, it might be easier for doctors to cite evidence to patients, like you said,
Yeah. Well, we
educating
do
them,
have.
saying, look, it's shown in studies that if we give you antibiotics freely, you're going to develop, you're more
C.
prone to get
diff.
develop rheumatoid arthritis.
Yeah, yeah. You're right. I mean, the reality is we know that C. diff is a disease that has been created because of overuse, over prescription of antibiotics, C. diff colitis, because we just change the healthy microbiome to an unhealthy one. And that is an example that's been well documented in actually New York Times and magazines that public reads on regular basis. Is just sticking to the points again and saying that, well, look, we're going to monitor you for 3 to 7 days for signs of serious infection. I just recently read that most sinusitis in America is treated um, wrong because up to 10 days you should not even be talking about antibiotics without clear signs of infection. But many times patients come with headaches and sinus pains and we prescribe them antibiotics, and that
Mhm.
lead to just problems that are not really long term gonna be harder to solve.
Okay, well, we'll stay tuned at the developments with the microbiome, and we thank you for coming out this week again.
All right, thank you.
For
Very nice
keeping
talking to you.
keeping on top of what's in the literature in the rheumatology field, and we look forward to seeing you next week.
Thank you, John. Thank you for having me over. It's always my pleasure.
Thank you.